Well, thank you everybody for joining. So today's webinar is an opportunity for us to share with you some of the research that we've commissioned to explore what good engagement looks like. So my name is Alison Thwaites. I'm a Research and Evaluation Manager at the Care Quality Commission. At CQC, we're committed to being an evidence-based and learning organisation. And so we have a dedicated research programme and it enables us to undertake research and evaluation projects. And these projects then provide us with evidence that informs our approach. The research programme has got three primary aims. So the first is to identify evidence, so what makes effective regulation, and then we incorporate that into our approach. The second is to evaluate how we regulate and to understand our impact. And the third is to explore evidence on what good looks like in different sectors and settings. So this includes what good looks like for complex and emerging topics, in the hope that we can also help providers improve, as well as inform what we look at through our regulation. So the research that we're discussing today fits into that last category, evidence to inform what good looks like. So the Health and Care Act gave CQC a new role in assessing ICSs and local authorities. And so as part of our strategy, we said we would look at how services and local systems encourage and enable people to speak up and how they act on this feedback. So we commissioned Involve, who are experts in public participation, to help us understand the key principles of what makes good system engagement. I just wanted to reference that this research was commissioned back in December 2023 and it started early in 2024. So the context around system structures and our role in system assessment was a little bit different then. But we still think the findings of this project are really valuable for us, both in terms of our ongoing local authority assessments and our potential future role in ICSs, but are also hopefully of interest and of value to you as well. I'll just give an overview of the structure of today's webinar. So shortly, I'll hand over to Dominic from Involve, who will be talking us through the findings, and then my colleagues Amanda Stride, Deputy Director for Local Authority Assessment, and Laura Saunders, Deputy Directors for Integration, Inequalities and Improvement, will be giving their reflections on the findings, and then we'll have a chance for Q&A. So it'd be great to hear your questions or even just your reflections on the findings. There's a Q&A function where you can drop your question at any point, and colleagues and I on the call will be monitoring those, and we'll either respond to you directly or we'll publish the question and then answer it. We'll only be able to respond to questions about the report and the research today because that's our focus. And just to make you aware that we are recording this call so that we can make it available for those who want to listen back afterwards. So Dom, I will hand over to you.
Great, thank you very much, Alison, and thank you for the introduction. And thank you all very much for joining this morning. I really appreciate you making the time to come and hear about the research that we've done and some of the findings that we're really excited about and hopeful that they can be really useful. Due to boring tech reasons, Latoya is helping me out by controlling the slides. So I'm going to ask Latoya to click through some slides occasionally, but I'll first of all name this project and this research. We called it System Focused Engagement, and we're using this webinar to share the findings. So I will introduce myself a little bit here. My name's Dom Ward. I work for a charity called Involve, and we've been working with CQC over the last 18 months on this research. And on the next slide, please, I'll say a little bit about who Involve are. So Involve are the UK's leading public participation charity. Our vision is of a vibrant democracy where everyone can shape a society that works for us all. We have a mission to lead the UK in making participation and deliberation an everyday part of democracy to help meet the challenges of the 21st century. That means that we focus on public engagement in decision making and the activities that are undertaken by an organisation to create opportunities for the public to participate in informing and influencing decisions, policies and or service delivery. So the partners that we work with span all levels of government, all types of arm's length bodies, regulators, local government, central government, parliament, the voluntary sector as well. We work with a whole range of different organisations who help them do high quality public engagement and build their capacity to do so. And as with this piece of work, research into what good looks like and how that can be achieved. So to speak a little bit more on the next slide about the purpose of this project, which Alison touched on already. The aim was to explore what good practice looks like in systems when involving people, and ensuring people's experiences are built into planning and delivery of care in a way that leads to improved outcomes. And the second purpose was to identify how we can meaningfully scrutinise what health and care systems are telling us they're doing to involve people through CQC system assessment methodology. The reason for this is that public engagement helps health and social care systems understand the needs of communities. When done well, public engagement helps improve services, build trust, and ensures that people's voices inform key decisions. So as part of the Health and Care Act in 2022, CQC had a new role in assessing these health and care systems. And as part of that, they need to check how well those systems are involving the public and whether they act on the key feedback they receive. And this research was, as far as I'm aware, unique in focusing on assessing system level engagement. One of the really interesting pieces of this research, I think from an engagement perspective, was that often engagement is looked at as a particular project or a particular process, where a group of people who you can see in a room were engaged with on a particular question, and then a particular policy change was made as a result of it. But what this research was looking at is not just an individual piece of one engagement, but looking at how that happens across large systems, and what those systems can do to enable good practice there. On the next slide, yes, thank you, Latoya, you read my mind. The research went over just over a year or so, and it involved multiple stages, which the circle on the left-hand side outlines the kind of key bits of. So first of all, we started by writing a few scoping papers to sort of understand what was going on in the sector, what was already happening well, what the gaps were. We got together with a bit of a research residential with some of my colleagues from Involve, some colleagues from CQC, and a team of experts that we brought together who had varying different insights on health and care systems and public engagement. And there we started to work out what the detail of our kind of research questions should be and what we thought we might be able to find through that, develop our kind of hypotheses. We then use the outputs from that research residential to do a wide range of interviews and workshops with people across the systems. So that looks like people working in CQC in that assessment role, at that strategic role. We interviewed lots of people who are working across ICSs and local authorities as well in different roles, strategic roles and engagement and delivery roles. We interviewed a wide range of people who had lived experience of navigating those health and care systems as well. So what their experiences had been like of being engaged with and not being engaged with. So in those interviews, we were asking what people's experiences were and what the impact had been with good engagement, bad engagement, absence of engagement, who they saw as tending to be engaged with, what they thought could be improved. And we also got together in some workshops with some people as well. So some of it was interviews, some of it was workshops, but the focus was really bringing out that key lived experience of people who are navigating those health and care systems themselves. We also did a few other interviews with some VCSE representatives as well. The reason we did the research like that was to try and take as wide-ranging approach to it as possible, given the variety and complexity and also the changing nature of this area as well. The policy landscape has been changing over the last year, as Alison mentioned, and the reason we think this is worthwhile though is despite the kind of challenges in changing policy landscapes, we think that the impact that good engagement can have on people's experiences of health and social care is so important, as was borne out particularly in those interviews and workshops. We also look to explore the topic from multiple different perspectives within the systems. So like I said, those navigating them, those regulating them, those trying to affect change within them. But we probably drew, we drew very heavily from the lived experience of those people who are navigating those systems themselves. We did also conduct a literature review, which looked within the UK and internationally at what was out there in terms of good practice at a system level of public engagement, particularly in the health and care sector. And we also looked at what good assessment of systems in terms of public engagement can look like as well. All of those different strands of the research were then pulled together into that circle in the middle, which created the research report, which is what I'm going to be talking about today and sharing the kind of key findings from that and what we think we've learned from that. And it is worth noting as well that as part of this research, we wanted to make sure that we offered some practical guidance and support for CQC to support their assessment that they will then go on and do of those health and care systems. So there has also been a sort of practical guidance document that's been based on this research, which we have developed and shared with CQC for them to use as well. But like I said, we're going to be focusing on that circle in the middle today and going into the detail of that research report. And on the next slide, there are 3 boxes which can describe the 3 key areas of what is included in that research report. So as I mentioned, we've done this research in a changing policy context. So we've talked a lot throughout the research about ensuring that the principles which we kind of develop in this research are flexible and applicable in different kinds of systems and assessment types. They're not wedded to one type of assessment, or they're not wedded to a particular system, but we're going to talk through what that looks like today as well. So we've been trying to get that balance of detail and specificity with flexibility in that changing landscape. So the 3 key chunks of this research report are first of all outlining what we found engagement in health and care systems looks like when done well. So what that good practice looks like. The second chunk was our findings around how CQC can assess engagement in health and social care systems. And then the third section was drawing out what we understood to be key principles of good engagement in health and social care systems. And that last one was drawing together what we found from the research and also involves expertise as a public participation charity as well. I'm going to talk through those 3 in order. So we're going to start with what engagement in health and social care systems looks like and what good looks like there. So I'll start on the next slide. And yeah, we can skip into the next one. Thank you. So here there are, I think it's 9 bullet points that are the key kind of headings of what we found good practice public engagement in health and care systems looks like, or what we frame those bullet points around what systems need to do, what's required of them in order to achieve good practice here. I'm going to run through them one by one. I'm going to give a summary of them quickly, and then we're going to go into detail to explain what each of them means in turn. So first of all, a system needs to support appropriate and clear engagement. It needs to play a strategic role. It needs to provide a convening function. It also needs to plan and allocate resources and avoid duplication across that system. It needs to convene data about populations and engagement done with those populations. It needs to enable monitoring, evaluation, and learning. The system needs to support with appropriate reach of engagement, so who is being engaged with, who's being spoken to and heard, and who's not. The system needs to fit in with statutory responsibilities as well. And a system, in order to achieve good practice, needs to engage on the right topics as well. Now, these findings inevitably interact with each other. They don't sit completely separate, but we've summarized them in these bullet points to give a kind of sense of the broad picture. But as I go through them, you'll see the interactions between them as well. So going back to the top, looking at what supporting appropriate and clear engagement looks like. What does that mean, really? What we mean by that is that public engagement happens with a range of different purposes, scopes, and levels of power that's being shifted. And there's often there's a bit of a misnomer that sometimes it needs to be the biggest scope and the most ambitious purpose and the greatest amount of power being shifted in order to be good. But what we found from the research is that actually it's more about getting an appropriate level and getting that right and being purposeful of we're going to set the scope as this XYZ within the engagement. This is our purpose for the engagement. We're really clear about that. And this is the kind of power that we want to share or shift in that. And having that clearly set out from the start allowed for a kind of appropriate engagement to happen based on the topic and what could change as a result of it, crucially. That really helped to make sure that systems are able to make better decisions about which engagement methods are the most appropriate for the outcome they want to achieve. That point on methods particularly came out as well, where often there would be, we would hear in interviews about quite ambitious language around different engagement methods, but they might not always be the most appropriate methods for the type of engagement purpose or what the topic was or what could realistically change as a result of that engagement. So that's why we framed it about being really the appropriate and clear engagement that the system needs to help enable. The second point on playing a strategic role. So a good practice public engagement in health and care systems requires a system to be strategic. What we mean by that is there is a role for health and social care systems to provide strategic leadership across the system, including on areas of public engagement that would have a system-wide impact. So looking at that bigger picture. What we found from some of our interviews is that an effective way of achieving this would be ensuring that public engagement at that level is discussed during board meetings and with the most senior people in the system, and that they should understand and value how engagement works and helps the system improve and where it fits within that broader work as well. So seeing the place for it there. The third point is that systems need to provide a convening function for public engagement as well. They're so often not involved in the direct delivery of services, but instead systems will support convening and supporting engagement that happens across that system. We found that for good practice, systems should understand and have a level of maturity of thought and practice around what their role as a convener in public engagement can look like. And in the research report, there's more detail as well on what the differences are there between what delivery might be and what convening looks like as well, because we recognise that a lot of the time ICSs and local authorities may not actually be doing that engagement directly themselves, and it may even be that it's being done by arm's length bodies or done by the voluntary sector at times as well. The fourth bullet point is that to achieve good practice, health and care systems need to plan and allocate resources and avoid duplication of engagement. As with anything, public engagement does require proper resourcing to be done well. And often that is a really clear indicator of how serious a system is about public engagement. And you can ask questions about how well its resources to understand what sort of level of commitment has been made there. The point on avoiding duplication is really, really important and does actually relate to the next point on convening data as well. But I will explain often one of the barriers that we found in engagement and more widely in the research, and engagement more widely, is that there can be an engagement fatigue of people who've been engaged with by lots of different decision makers, whether it's local government, whether it's health and care systems or national government, whether it's charities, all asking similar sorts of questions, asking people to share their experience and share how they think something could be improved. And that can really lead to a level of engagement fatigue for people where they've had to share their perspective so many times without there being a clear follow-up and clear impact. And actually that can be really damaging to the trust that's there in the system and also institutions more widely, if people are being asked to share their perspectives very often without there ever being a clear follow-up or impact, or even the experience of asking someone to share their lived experience when your colleague has asked them 6 months ago to do exactly the same thing. So it's planning that at a strategic level to avoid that duplication. Not only does that save the time of the people you're engaging with, but also does save resources internally as well. In terms of convening data, we found that the role of a system that is achieving good practice is convening data from engagement, so that data helps systems to identify where engagement is needed, what topics should be explored, and which communities should be involved, crucially. It can also highlight which groups of people are heard from regularly, as I was mentioning before, and which are less so as well, especially amongst those most affected by health and care decisions. Linking on to that is the next bullet point around enabling monitoring, evaluation, and learning. When achieving good practice, systems will be convening a kind of monitoring, evaluation, and learning function that's instrumental in the delivery of that engagement, and ensuring that that learning is spread across the system as well. So often we heard about good practice happening in pockets, but there was often a lack of effective monitoring, evaluation, and learning, which would then distribute that learning and that good practice across the system. When done well, that can look like providing resources, sharing effective approaches, and overseeing continuous monitoring, evaluation, and learning. The bullet point underneath that, highlighting the need for a system to support appropriate reach. Appropriate reach really is about speaking to the right people for the topic that you're engaging with. Across our research, we heard about the importance of engaging with the right people, recruited in the right way, and also effectively supported to engage as well. Crucially, making sure that you're making those reasonable adjustments to enable people to fully participate and for them to feel safe and confident and comfortable engaging with the topic that you're asking them to. Linking to some of the previous bullet points about avoiding duplication, convening data, and enabling monitoring, evaluation, and learning, we found that to enable kind of appropriate reach of engagement, systems should be using population and previous engagement data to identify who are the right people for us to be talking to here. And that often needs a really, really careful consideration, because the right people to engage depends on the topic, purpose, context, and historical engagement context, as well as a number of other factors as well. Sometimes that might even look like resource dependence as well. Second to last in the bullet points on this slide is the importance of fitting in with statutory responsibilities. This might seem like stating the obvious somewhat. Of course, you have to meet your statutory requirements, but it's worth just naming those as well. So the requirements around public engagement. Attention should be given first to whether systems are meeting their statutory obligations, of course, but also to what extent their approach to meeting these requirements seems like it's being treated as a tick box exercise just to meet the obligation, or whether it actually goes further with high quality and meaningful engagement that's embedded within the system and helps to optimize all parts of its role through doing so. Yeah, I think that point can be summarized as, yeah, there are requirements that mean all systems have to be doing some sort of engagement, but it's about asking, is it going further? Is it trying to really achieve meaningful impact, or is it treating it as a tick box? And I think in a lot of ways, drawing together a number of the findings above, the last bullet point there on the slide is about engaging on the right topics. When a system is achieving good practice in public engagement, they are managing to engage on the right topics. So a lot of time that examples can be things like engaging on system governance and service delivery planning, looking at public health as it goes broader than the provision of services, and also exploring lived experience of a particular issue or service. So that's what the kind of right topics could be. as examples for systems to be looking at. That doesn't mean that the providers themselves shouldn't also be doing more specific engagement on particular aspects of the service that they're providing. But even then, you can apply the same question of, are we engaging on the right topics that are going to make a difference to people's lives, or are we engaging on what colour to paint the door? So it's thinking about what's going to be meaningful to people's lives, and at a system level, that can look like those kind of system governance and service delivery planning and public health. So those were the kind of key areas of findings of what good practice public engagement looks like in health and social care systems. Those were all outlined in the report as well that's been published on CQC's website and also on the Involve website. And those are what we found from our literature review from all the interviews that we did as well. But I'm now going to talk about the section that focuses more on how to assess engagement on health and social care systems as well. So first slide on this describes what we found were the highlighted as potential sources for assessment that would help identify good practice in health and social care systems. One of the big questions within this research was, what should we be looking for to identify good practice, and where should we be looking for it? Often public engagement exists as a sort of golden thread throughout a number of different parts of the assessment. So some of this research did focus on where should CQC be looking for evidence of good practice. So first of all, in leadership and strategy, our research found that leadership is crucial in shaping organizational culture and securing team-wide commitment. So clearly what leaders prioritize then ends up being prioritized as a organizational objective too. And when public engagement is prioritized, that signals to the public that their views are important and enables the delivery staff to kind of follow on from that as well. We did also find the value of leaders taking practical steps, such as allocating resources and implementing supportive measures to ensure that engagement efforts can be effectively carried out. And for those kind of practical steps, you could look at the previous couple of slides, looking at what good practice looks like to understand what those practical steps could be. Another area is that public participation in decision making. So looking at what decisions are being made across the system and asking where the public have been engaged in them as well. So looking in particular at wider governance practices was an area identified within the research that systems could be assessed against. Another source for finding out how a system is doing and assessing them is relationships with VCSE organisations. What we found in the research was that VCSE organisations play two distinct roles in these systems. So first of all, as a part of the system, or organisations commissioned by the system to carry out public engagement directly. And the second role they play is often more as an advocate or as a proxy, being engaged with by the system, so representing a particular interest or demographic group. Both of those roles can be really important for evaluating systems and interrogating how well those roles are going. But yeah, we found that it could be useful to assess how well VCSEs are supported as parts of the system, how effectively they're commissioned to drive engagement within a broader strategy, and how they're engaged with to provide the views of the people that they support. One thing to note, though, is that in the research, we did also find that some participants were warning against over-reliance on VCSEs, as they were seen to potentially have organisational bias and aren't necessarily representative of the general public either. And then looking at engagement reach as well, we touched on this in a couple of the previous slides as well, but a key area for assessment is asking who has been engaged with and asking the system how well it can articulate who's been engaged with, why they've been engaged with, and at what time, what the impact of that has been. And there are a number of different kind of answers that could be useful and appropriate. So it could be people who are affected by a decision or an issue, people with relevant lived experience, a range of people from a sort of geographic place or a demographically representative group. All of those are different ways of kind of bringing together groups of people to engage with. Then on the next slide, we've got some of the key kind of materials and areas to look at to identify good practice in health and social care system. So we found that reports like annual reports, impact reports, and project focus reports could all be a useful resource to look for, as were minutes of meetings, particularly where the public are involved. Some of the system structures like databases for collating engagement outputs and central support for delivering engagement resources as well, and clear points of contact. Where those all existed and were interacting, that could look like good practice, but in some instances they might not exist at all, and that could really highlight areas for improvement. And then also relying on some of the testimonies that people provide from leaders and strategic decision makers, as well as people involved in delivery of the engagement and those who have been engaged as well. Clearly getting those people's feedback on what's happened, what's been the impact, what was their experience of it is really important. Complaints did also come up often in the research, as clearly they're a very direct way in which information is communicated back to a system about what's not going well, and they are really important for systems to be responding to, but they're not necessarily a reliable indicator of engagement or what engagement has happened, but they can give us an insight into the level of public trust there is with a system. Then on the next slide, we had some key findings of what CQC needs in order to be able to assess good practice, because what we found were actually we're able to articulate what good looks like and where you might find it, but there was a bit of a kind of capacity building need for CQC as well. I mean, I think Alison said at the start about CQC being a learning organisation, and this is the slide that kind of describes what CQC has kind of been learning and developing here as well. So one of the findings is that we actually thought it would be really useful to develop a baseline engagement standard as well, because so often the question has been, well, how do we say what good looks like when we don't know what the minimum is happening, or what different systems are managing to do? How do we kind of create a fair and appropriate assessment of that? We found there was a need for training for assessment teams, which has happened earlier on this year, because assessors aren't necessarily, it's not fair to expect them to be absolute experts on public engagement. So we found that developing this training that helped them understand what the findings of this research was, and also how they can use some of the practical support that we developed for them as well, to identify those indicators of good practice when conducting assessments. Linked to that is the kind of flexible assessment guidance. So we've developed that kind of practical support that assessors can use, and we try to ensure that it remains flexible for a changing policy context and can be applied to a number of different types of assessment and systems. Even from the start, we were looking at ICSs and local authorities, not just one or the other. And then the last finding that we've been addressing with CQC as well is the need to refine some terminology to support clear and consistent use, because what we found across systems, across the regulator, across the people who were interviewing about their lived experience as well, there was a huge range of different terminology used about engagement. And so often people would talk about co-production, but that was often used to describe a range of different types of engagement with, crucially, different types of power being shared, sometimes very little power being shared and very little impact being had, but it was still being described as co-production. So as part of the outputs from this research, we've also included a practical resource that CQC can use to kind of refine that terminology, because ultimately, it doesn't matter what everyone's calling it, as long as everyone's using the same words to describe something, then UC can meaningfully assess it. But if you're not using the same language as each other, then it gets very, very difficult to figure out whether something's been done well or not. So that was the summary of what we found CQC needs in order to assess engagement in health and social care systems. And last of all, I'm going to talk about how we kind of compile those findings about what engagement looks like when it's good practice, how to assess it, into a set of principles that we thought were applicable across health and social care systems for public engagement. So I'm going to talk through these 8 principles one by one. Again, they do interact with each other, and we found that after sort of multiple reviews and considering the best way to kind of explain what each one was, we found this was the best way to make sure that we covered all the key bases, but some of them do interact with each other. So the purpose of these principles is to inform how CQC could approach their assessment process and also capture what good practice looks like in the emergent role of public engagement in health and social care systems. So number 1, leadership. We think that engagement in health and social care systems should be driven by strong leadership that fosters a culture of engagement and is integrated across all parts and levels. By making public engagement a priority, they encourage all staff to value the knowledge, experiences of the public when shaping services and deliveries. And in the research report, there's quite a lot more information about how this kind of trickles down into a system when it's set from that leadership level. Number 2, we found that a system needs to ensure that public engagement in those systems is meaningful. What that means is that all engagement should be driven by a clear purpose with transparent impact on decision making, as we've talked about a little bit already. There need to be structures and processes in place to track the impact of public engagement. And this is because engagement that produces little real impact can even harm participants sometimes, especially if we're asking people to repeat the difficult experiences they've had. We talked about engagement fatigue earlier. It wastes time, damages trust, and often it can mean you're engaging with the same narrow demographic representation. And that can really damage the services that are delivered after that, because services that are informed by a wider group of people and all the people who are impacted on them, rather than that smaller group who is maybe easily accessible to the system, will be stronger and more effective services. Number 3, system influencing, I think mostly speaks for itself, but as a general rule, when policies and strategies are developed with genuine public and VCSE involvement, they're more likely to meet the real needs of the people that they serve. Number 4, we talked about appropriate in the findings as well, but it was important to include this as a principle here. It's about making sure that whilst there's no right way to do engagement, there's a thought-through approach that factors in why engagement is needed, what the scope of the topic is, who needs to be engaged with, and what the kind of desired outcomes of that are, and then what sort of power is going to be shared with the public in order to achieve that. The most suitable engagement method always depends on the purpose and reach, social, cultural, political, and historical context around that topic. Relatedly, ensuring that you've got appropriate reach within engagement as well, so who takes part. I think we've talked a fair bit about that already, but to design fair and effective services, engagement must reach those diverse voices, especially groups that are often left out of decision making. And part of achieving that reach is making sure that engagement is accessible as well, the 6th key principle there. So without careful planning, so often public engagement tends to attract a narrow demographic group. This was something that came out in the research a lot. People who don't face material, health or socio-cultural barriers to engagement. And whilst those people's views do matter, relying only on them, as we heard in the research can happen, can lead to a limited understanding of what different communities need. And whereas people who do not usually engage face barriers to public participation. Those barriers are often unknown, hidden, or difficult to overcome, but could include financial constraints, lack of childcare, historical power imbalances, the tone and assumptions in invitations to engage, and many, many more. But if no work goes into identifying and overcoming those barriers, it can really, really limit who takes part and will favour those with more time and resources. The seventh key principle relates to the monitoring, evaluation and learning that we were discussing earlier. So it's about that ongoing learning that ensures service and system-wide engagement activities meet their intended purpose and feed back into systemic learning on contextualized good practice. And then the eighth key principle is that systems need to ensure that engagement in health and social care systems is effectively coordinated, that avoids duplication, shares insights, and maximizes resources across the systems. So those were the key principles that we developed based on our research and involves expertise in public engagement. And they pulled together what we found good could look like, what we found some of the challenges were, and also were related to how CQC can be assessing them as well. And these key principles are for what good practice can look like at health and social care system level. So I think we've covered the next slide as well, just provided a quick summary of that. I think now we've got a bit of time to take questions, clarifications, and reflections. I think we can take those questions in the chat, I believe. And we've got a couple of people from CQC, so Amanda Stride, Laura Saunders, Alison Thwaite, and myself from Involve to answer those questions as they come up as well. So I think I'm right in saying we're inviting questions now through the chat. Is that right, Latoya?
Yeah, that's right. Or we could have Laura and Amanda share their reflections on kind of how they've used this research.
Yeah, that would be wonderful. Thank you.
Okay, I shall go. I'll go first from the local authority perspective. So I think, as people on the call will know, we've been undertaking our local authority assessments, and part of that is we do look at how the local authority does what has come under the umbrella term of co-production, and we do report on that. So we've been building on the training that we've had. We've had Clinton Farquharson come and talk and do a learning and development session with the team as well, and he works for TLAP and has been talking all about engagement and co-production. So we've kept a bit of momentum going in terms of building on that learning. But as Dom's referenced, one of the things that we've been looking at is kind of like language and what we understand by what we're asking and what people are telling us and where that actually fits. And we're also working very much on kind of revising our guidance internally on what we do and how we're engaging with the local authorities on making sure we're talking to the right people about the right things when we're talking to co-production groups. So something we're in the early stages of, but something that we're really keen to keep building on. And we've had some local authorities who have also said that they've got people who want to kind of help us get it right as well. So it's something that's really got a bit of momentum with our team that we're taking forward. So.
Thanks, Amanda. Yeah, so I suppose from the kind of more system, cross-system and cross-sector regulatory landscape that is ever evolving at the moment with the recent 10-year health plan, and also the review from Penny Dash around the kind of quality landscape, we're really considering about how those principles might be transferred into that new kind of system architecture. And you can see throughout those new documents, including the ICB blueprint, that engagement and strong strategic engagement and co-production is absolutely essential to taking our health and social care system in the direction of as is asked by the 10-year health plan. And the scales within that are really interesting as well. So one of the things that we're really considering both internally and then how we reflect the external landscape is what happens at scale. So as Dom's referred to, that kind of convening role and function. So if we're talking about ICBs moving to much larger geographical footprints and populations, how you hold that convening function all the way down through to hyperlocal initiatives that we would see. And how does that then correlate or move across to our provider level regulation? So through to sort of smaller providers and care homes up to the larger acutes that are increasingly being asked to take on more system responsibilities. So it's definitely what we've got is a strong set of principles which are entirely transferable. But we have an ever-changing and evolving landscape that we think will move at pace, as is set out in the 10-year health plan. But also not forgetting the role and function of the local authority, and we're lucky to have our local authority assessments underway, and that ability to kind of connect the dots. But it is weaved in and embedded throughout those policy documents, and as I've already mentioned, so for us it's absolutely critical that we think about how we would reflect that within our kind of cross-sector regulatory delivery as we begin to strengthen both our provider level inspections and assessments, but also how we begin to bring those together so we've got a clear understanding of system oversight and care and quality in a place. Of course, we'd probably be a bit remiss not to say that there's some learning in there about how we engage as well as an organisation, and it's not just about how we assess as part of our regulatory functions, but there's also something about how we use these principles to think about how we engage with communities and populations to inform our work as we move forward. Underpinning all of this is absolutely critical to reflect our local communities, populations, and the people that use services to tackle inequalities and social injustice. So we're really keen to think as well, also how can we be better using these principles ourselves in the work that we're doing. So thanks to Evolve and colleagues for the fantastic piece of work.
Thanks, Laura, and thanks, Amanda. We don't have any questions in the Q&A, but attendees, you can raise your hand if you'd like, and I can unmute and put you on camera. Yeah, we'd really welcome your reflections, particularly around, what are you currently facing in your role in terms of engaging with the public or working with the organisations that represent them. Any challenges that you find within the report or the findings. So yeah, we're opening the floor to any thoughts around this research and what we've discussed today.
I think it's probably likely as well that people are feeling a little overwhelmed with all the information. I know it's a lot of information to take in all in one go, but as I mentioned, the report is available on the CQC website as well as the Involve website for people who want to go back and look at it in your own time as well.
Thanks, Dom. Katie? Do I have to unmute you? Can you do that yourself?
I think I can. Hello?
Yes, I can hear you.
Thanks very much. Yeah, fantastic piece of work. Fantastic that CQC's commissioned it. So thank you very much for talking us through it, and completely agree, Laura, with your point around actually this would be a great piece of research to use to help us audit ourselves organisationally as to how well we're doing public engagement as the regulator. In terms of a question, just interested in whether the research is helping us better understand what sort of time resource is required for CQC to assess this area well in our inspections. So I think you talked about the need to both look at documentation and then to corroborate that with essentially oral evidence from people who have participated in an area in public engagement and those who haven't participated in an area, and to do that is potentially quite time intensive. So yeah, did the research get into that sort of practical level of what sort of time resources involved in order for CQC to do this work well, do this kind of assessment well?
I'm happy to start an answer to that, and then I think it probably is better taken forward by some of my CQC colleagues. The answer directly to your question is no, we didn't look at, CQC would need to allocate X number of assessor hours to achieving this outcome. Most of the reason for that, being honest, is a practicality of going into the detail of how CQC would gather all of those different pieces of evidence and what it would do. To go to that level of detail across the research would have made it unwieldy in terms of size. So what we did as a kind of approximation was so Alison and I would meet very regularly to try and approximate, what do we think is reasonable? What's our best assessment of what's reasonable. When we were sense checking the research and the findings with colleagues within CQC, we were using those opportunities of review and sense check to make sure that it seemed like we weren't asking for something completely unreasonable or suggesting, all right, you need to have the moon on a stick here. But we didn't go into the crunching the numbers of, okay, and it'll require X number of hours from X person in X scenario. But I think that kind of hits on a general theme of this research, that we sort of were able to take it so far. But I think what Laura was describing quite nicely is there's a role that CQC has of applying this research in a practical way that the research itself can't do. It's the expertise that's held by CQC colleagues who are then able to put that into practice. But I'll hand over to CQC colleagues to add anything that you want to that.
Yeah, I don't have anything to add other than what you said, Dom, because essentially the scope of the research that went out, it was considered, I think, initially whether it's something that we could do, but given the timing of, the local authority assessments were just beginning, kind of discussion around what the ICS methodology would be was also kind of very much in its infancy. And so, yeah, the scope of this project seemed to be much more better focused on what is that, the kind of good principles of engagement that we can then weave in. So I think like a follow-up piece that would probably be best place for us to do internally would be then that modelling of what that looks like in practice. But it still feels quite early days to be doing some of that in our assessment methodology, but it's something we could reflect going forward potentially.
Yeah, and I mean, Amanda, obviously you're kind of doing this in real time, and I think but thinking a bit more broadly is there's such a huge scale, isn't there? Even if you were to take one size of local authority, they vary so broadly, and the same with systems and the varying different levels of systems. So I think we're kind of increasingly looking at when we refer to systems and systems oversight, what do we mean by that? What's the scale? What are the different functions, as I alluded to earlier? But then no one size fits all, and we're seeing that across the emerging kind of health and social care landscapes, in particular that ICB almost going up to 4.5 million in some cases. So we're really thinking about that adaptability of these principles at those different levels and across the different scales. But even we couldn't even say sort of in a local authority or in a single provider it would require this much time. Because they are so varied in scale and complexity. So how we make this out, how we think about the agility minimum standards, maybe minimum level of capacity might be something that we think about as we move forward. But building up from there, I think having a range of different ways to ensure that this does come through our assessments will be really, really critical. But I'd be cautious of sort of pinning an amount of time or capacity because of that scale and complexity challenge that we have across the kind of national footprint. I think it's more important that we're really reflecting our assessments are reflective of the systems or the local authorities that we're going into. But Amanda, you correct me if I'm wrong there, with a bit more real time experience.
No, I thought that was a really good answer in terms of that. And yes, I think as we get more and more knowledge of what we do and how we do it, I think that starts to kind of answer some of the questions. But yeah, we have to be mindful. Local authorities are in different places, and they're also going to be undergoing quite a bit of change over the next coming years as well. But I think the important thing is that we make sure that we are allocating enough time to talk to the right people about the right things, and I think that's one of the time consuming aspects of it, is to make sure that we can do that and do it well.
Thanks, Katie, and thanks everyone for responding to that. We have a reflection from Nina just saying the power imbalance was really insightful part of the research, to have more assurance of this in engagement process. So just when we talk about the power imbalance of engagement and how people respond to that was really insightful to hear about. So thank you. So the next question we have in the chat is from Michaela Pinchard. So the question of the language use is interesting. Do you have any further examples of what kind of language you feel represents a healthy engagement culture?
Sure. So when I talk about the language, the first kind of barrier I think we found in the kind of interviews stage of the research was that people in different roles in different systems or different organizations were describing similar activities with different words. So some might say, oh, this was co-creation, or we were empowering people here, or we were collaborating with people here, or we were involving people here, engaging with people there. And there was a lot of kind of vagueness in the language, not necessarily of each individual, but when you were trying to look at that systems level, it was not always very easy to know what activities and what power and what impacts were actually being described, because often people will use that a kind of methodology. They might say, oh, we had a resident panel to explore this issue, for example, but it's more about what happened within that than the naming of it. But the naming does make a difference for CQC to then understand, right, so we're assessing whether that let's say that resident panel was done well. In order to meaningfully assess it, EQC needs to know what a resident panel is, what good looks like, and have the same understanding as the system as well. Whereas if there's different understandings and different purposes, but that are using the same term, then that can make that assessment really, really messy, because you could be getting unfairly assessed potentially of, oh, well, a system uses a term that CQC understands to mean these 5 different things, whereas the system only understands it to mean one smaller thing, and you kind of get unfairly assessed as not having done that well just because you're using language differently. If I understand the question correctly, though, I think that was more about sort of the power structures within language around engagement. Can I check, was that sort of was that what the question was getting at?
I can try and unmute you, Michaela, and see if you could maybe confirm for Dom if that was correct.
Thank you.
Michaela, if you'd like to respond, I've unmuted.
Yeah, I mean, it's so kind of multi-layered, isn't it? But I think there is something about, what you described there as what CQC understands as good, and then what the system understands as good, and how the two come together, as well as then those power dynamics, because we know language, language can create different power dynamics. So it's kind of both, but it's how do systems understand each other, but also then understand what CQC determine what good looks like. So I think what you're saying is, as a system, you have to align your language and have a common set of, this is what we mean by a residence panel, this is what we mean by co-production, etc. But then it's aligning that with what CQC think too.
Yeah, exactly.
Thanks, Michaela, and thanks, Dom. We have run out of time, unfortunately. So just want to wrap this discussion up. Thank you so much to everyone for joining. We will be sharing the recording on YouTube as well. Apologies. But yeah, thank you, everyone, and have a lovely day.
Thank you. Thanks very much.
Thank you all very much.